Our ongoing coverage of the coronavirus pandemic continues this Wednesday evening. Thanks for joining us, everyone. I'm Chris Pisano. Here's the latest headlines. Lawmakers on Capitol Hill inching closer to passing a $2 trillion stimulus package that would help out many Americans just trying to make ends meet. Senate leaders reached a deal with the White House last night. Governor Baker has just announced schools will reopen now, no sooner than Monday, May 4th. And more communities announcing their first cases of the virus. South Hadley, and Wilbraham joining the growing list. The coronavirus stimulus package expected to be passed in the Senate by the end of the day. That bill providing direct payments to American families struggling financially, but it also provides aid to businesses and hospitals. Western Mass News reporter Audrey Russo joins us live in Springfield with more on that side of the stimulus deal. Audrey?
Chris, a moment ago, I heard you use the phrase inching closer. Some reports showing that lawmakers may be hitting a snag in passing this stimulus bill. But in the package, it reportedly contains as much as $100 billion to help hospitals deal with surging caseloads. Western Mass News spoke with one local hospital executive who says that access to medical supplies still remain a critical part of fighting the coronavirus. The Senate reaching a deal early Wednesday morning on the coronavirus stimulus package. The $2 trillion proposal includes $350 billion in small business loans, $250 billion in unemployment insurance benefits, and $500 billion in loans for distressed companies. But perhaps the most pressing for those on the front lines is at least $100 billion earmarked for hospitals. Right now, local hospital officials explain the federal help they need most.
I would say access to adequate supplies, whether it's PPE, whether it's ventilators.
Dr. Saeed Hussein, the chief clinical officer for Trinity Health of New England, says they're evaluating their supply needs by keeping an eye on places with more cases of coronavirus, like New York City.
Their need for more ventilators, that I would say based on our own modeling predictions, ensuring that we have enough supplies and PPE so that our clinicians can take care of folks during the surge.
Hussein says they've set up a dashboard within their hospital system to track their personal protective equipment. He says conserving N95 masks and keeping them clean enough for possible reuse is paramount.
Educating staff on when an N95 mask is really necessary is important. And in addition, encouraging staff to be able to use covering on the mask so that we can conserve those N95s, which are in great demand nationwide. And also, we've started reprocessing N95s and looking also at other modalities such as ultraviolet.
Now, should this stimulus bill pass in the Senate, if and when it'll go to the House next for approval before landing on the president's desk, Treasury Secretary Steve Mnuchin telling reporters today that if it were to land on the president's desk, he would sign it into law. Live in Springfield, Audrey Russo for Western Mass News.
Audrey, thank you for that live report. The number of cases in our state continuing to go up as more tests are now being processed. The DPH says there are 1,838 positive cases of coronavirus in the Bay State, and 15 people have died. That is up 4 from yesterday. 2 men in their 80s, as well as a man and a woman in their 70s. 2 of the men and the woman had pre-existing conditions. 103 people have been hospitalized. Middlesex County has now the largest number of cases at 446. Here in Western Mass, the state says Hampden County now has 45 confirmed cases. Franklin County 14, Hampshire County has 11, and Berkshire County has 71. Our team coverage continues as Governor Charlie Baker updates the Commonwealth on some changes in the midst of the coronavirus pandemic. Western Mass News reporter Lindsay Kane joining us live in studio with more. Lindsay?
Governor Baker just signed an order issuing all schools and non-emergency daycare programs to close through the end of April, opening no earlier than Monday, May 4th. Governor Baker says it's important for students to continue their learning at home and acknowledge the difficulty this situation has caused for parents, students, and educators. He says that educational programming will run on TV between noon and 5 Monday through Friday. He also says the 400 emergency child care programs throughout the state will continue for parents with essential jobs like first responders, nurses, and grocery store employees. But as for grocery stores and pharmacies, you can expect some changes the next time you shop, all to help stop the spread of the coronavirus.
Reusable bags are prohibited, and all regulations on plastic bag bans will be lifted. Finally, stores are not allowed to charge for paper and plastic bags at this time.
Governor Baker also says that grocery stores are required to provide disinfecting products to be used by shoppers. He also says it's important to make sure social distancing is still taking place at grocery stores, making sure customers and employees are staying 6 feet apart from one another. In studio, Lindsay Kane, Western Mass News.
Lindsay, thank you for that live report. Now, much has been made of President Trump's call for the economy to reopen by Easter. It's an idea that many medical experts have now come out against, saying Americans will need to continue to practice social distancing in the wake of the coronavirus pandemic. Vice President Mike Pence, who chairs the president's coronavirus task force, spoke with our sister station, KTVK, in Phoenix, Arizona, earlier in the day. He says the president is being guided by a trusted group.
Rest assured, every decision President Trump has made and every recommendation that's come from the coronavirus task force at the White House has been driven by the most brilliant experts on infectious disease in the world. But the president expressed a desire to see America get back to work just as soon as possible. And we're going to be bringing him all the best information about how soon we would be able to put portions of the country back to work or certain Americans back to work.
The vice president says the best thing Americans can do right now is to take the task force's advice and continue their 15 days to slow the spread of the virus. He says they're working hand in hand with governors across the U.S. and urges residents to follow their advice and orders as well. Due to the coronavirus pandemic, people who feel sick are encouraged to utilize telehealth options instead of just showing up at a hospital or their doctor's office. We wanted to find out how that's working. Western Mass News reporter Sarah Granelli getting answers tonight, and she joins us live in Springfield with what she's learned. Sarah?
Chris, it's a way for you to speak with your doctor without having to leave the comfort of your home. With the spread of the coronavirus, many doctors and patients have been turning to telehealth.
A patient would meet with a provider over a virtual video screen as opposed to being in the four walls of a doctor's office.
Western Mass News spoke with James Beam, a managing director of Global Healthcare Intelligence, a company that analyzes telehealth services around the country. He tells Western Mass News it helps doctors and their facilities stay safe, even if someone does have the coronavirus. It also puts less strain on the doctor's resources.
If someone does have primary diagnosis of COVID-19, they can consult with their physician, via a virtual video rather than a face-to-face encounter where there could be a secondary infection between the patient and the healthcare professional.
But how does a virtual diagnosis work? Beam says doctors ask patients about their symptoms, and then if further action is needed,
it can help coordinate the care of the patient who would need their temperature taken or would need some sort of examination and direct those patients to the most appropriate care. Again, in this case, during COVID-19, we can assume that at some point here over the next couple of weeks, telehealth can be used to direct people to where they can get tested outside of a hospital. So say a retail pharmacy setting like CVS or Walgreens.
Beam says more than 50% of Americans struggle with how to get in contact with a telehealth provider, but that is on the rise.
I would say that in most cases what we've seen nationally is health insurance carriers are trying to promote telehealth during the COVID-19 crisis. So check.
And Beam says to check with your health insurance provider to see if you qualify to use telehealth services. Live in Springfield, Sarah Granelli, Western Mass News.
Sarah, thank you for that live report. New at 6, the Massachusetts Gaming Commission voted unanimously to extend the temporary suspension of operations at the 3 casinos in our state now until April 7th. And that includes MGM Springfield, the Plainridge Park Casino, and Encore Boston Harbor. The commission will then review and reassess this status of operations before April 7th. MGM Springfield releasing a statement on the extended closure. President Chris Kelly saying in part, MGM Springfield will remain engaged with the local community to support frontline workers, organizations, and residents most impacted. And in Chicopee, Mayor John View reallocated $150,000 in federal community development block grant funds to create an emergency fund for businesses. That city anticipates providing funding to 15 to 20 businesses in the city that are being impacted by the coronavirus. The grant application is posted on the Community Development Department's page, or you can also give them a call. And for more coverage on the coronavirus emergency as it continues to develop, log on to our free Western Mass News streaming app.
If you blinked this morning, you missed the sunshine, but the skies are starting to clear just a little bit into the 6 o'clock hour, starting to see a little bit brighter skies, and those passing showers that we had been talking about are mainly out of here. So nothing but maybe a passing shot of drizzle into this evening. Our highs only reached into the middle 40s, 45 in Springfield, 44 in Westfield, and 42 degrees in Orange. You see the clouds that are still around, but the darkness of the clouds. Notice how it's really dark over in Worcester County, starting to brighten up just a little bit through the Pioneer Valley. And we will see these gradually clearing as we go into tonight. The waves of showers coming off the ocean, they start to actually head to our south. So we're not expecting any additional showers into tonight. In fact, clearing those skies out, a lot of sunshine throughout the day tomorrow, a good day to go out and stretch the legs, just practice that safe distancing. Tonight, falling into the upper 20s and low 30s with some partial clearing. Many of us seeing some stars into tonight. Tomorrow, we're back into the middle 50s, a very pleasant day with a mixture of sun and clouds. Now, we do have some rain to talk about heading into Friday morning. We'll look at that coming up in just a few minutes. Chris?